So we move on now to patient feedback. And I'd like to reintroduce Lorraine, who we saw earlier, who is one of the driving forces behind this in our cardiac rehab service.
Thank you.
Okay, so this feedback, this is patient evaluation feedback from the two projects, secondary care, primary care, as Prof Fisher just said. This feedback came from patients from two quite different socio-economic backgrounds. There's quite a massive difference between the projects. At the Royal and Broad Green hospitals, when we were undertaking the project there, a lot of patients there, we had interpreters, a lot of patients English and primary care, yeah, and a lot of professor retirees there, so quite a vastly different socio-economic background. I don't know if that makes a lot of difference.
Yeah, so basically we wanted to get some feedback from the patients to see how they found the service was running really. Did they get, you know, how did they find that we were working and how did we help them? So the first question we asked them was, did the verbal information that you received from your nurse or pharmacist meet your concerns regarding your cholesterol? And yeah, okay. So the primary care, Marge sent out some questionnaires via text messages.
Yeah, through the ACRIC system. A lot of people went on mobile phones, quite elderly. I'm not good ages, but a lot of people very elderly didn't have mobile phones.
And we just picked a selection of patients and give them a paper copy to fill out while they were coming into the clinic to see us face to face. So regarding that question in primary care, primary care.
So right, so I sent out about 56, sort of like a survey monkey. And I think I got about 15, 16 patients back, and apparently that's good. So 7 said that they were happy with the verbal information they received, and 6 said they were happy with some of the verbal information they received.
And regarding the secondary care, our side, all was 28, and some, just 3 people said some.
So the next question we asked, we did try and do the same evaluation. So obviously, just to make these comparisons, very positive feedback, and on both sides, most were competent in managing their cholesterol. There was nobody that come back and said that they had no confidence in being able to manage their cholesterol. So in the secondary care, they were all
they were all really competent,
yeah.
And as Joanne said earlier, they're really pleased to see someone basically, and Marge reiterated that they'd not seen anybody for a while, so they went away feeling very confident. So some of the comments that were made on our questionnaires were they would have liked more advice on medicines. The consultation fulfilled all the information requirements, and they were thankful for the time and the expertise that was given by the staff, and they thought the staff were listening and gave quite a lot of information and care. They felt they'd previously been left in the dark, probably because of COVID as well, and they'd not seen anybody, and they would have liked more follow-up from the lipid clinic. Even the patients that were hitting targets as well, they really were quite keen to come back. And then obviously we had the problem with the bottle shortage before we had the point of care testing machine. So some of the blood tests were late, and the patients were a bit frustrated about that because they couldn't come to the clinic when we asked them to come because the bloods weren't ready in time.
So primary care was a little bit different. I had a couple of comments. One was a retired GP. Said, I'm aware of the problems, but as a patient, it is easy to ignore the significance of the consequences of ignoring the advice. And I remember him very well, actually, because I didn't want to sound like I was telling them off. He said, I know, I'll have to do better. I felt awful after, but he's a very nice gentleman. And another comment said that this patient would like more information regarding pros and cons of statins. So I found I had my work cut out in Ainsdale Medical Centre because of a lot of patients, well, quite a lot of patients, especially there were so many that were deemed to have statin intolerance, that you really had to argue the case for statin, what has been done before, and and just, I think a question was asked today about, can it cause diabetes or dementia? You get those as well. I think we've had that in secondary care as well, haven't we? So quite difficult really, but in general, I found patients usually thanked you at the end and said, thank you so much. That's made a lot of difference, and it's been really good to talk to somebody. So
yeah, 100%.
It was about quite a bad time anyway. I think that's basically it. Yeah.
Any questions?
About the patients who don't have a mobile phone, so you said it was close to life. Are there other suggestions of a family members putting their phone forward, or we'll talk about that? That's just because of a big issue, but it is those patients. So is there, do you suggest?
Maybe I should ask Dr. Bennet that. How do you get it?
I think you have to. It's not as simple as it seems.
Yeah,
because of data protection and actually communicating to a number that you have in record. You have to be confident that you're sending information to the right person. So yes, it's difficult to do that. We constantly try to get people on the phone, and I think the numbers would be skewed a bit. And we're actually constantly striving to increase the number of contacts. And amazing, actually, the number of people 80 plus who actually do have a mobile now.
Yeah.
It's
Yeah.
data security.
Yeah, we can't make assumptions it's due to age, but there are a lot of people could contact.